They said most of you now suffered from what Nurse Priska called mind-skipping syndrome. Your mind now skips whenever you hear antenatal care. Why? Because you heard that you will be asked questions on your first antenatal visit, and you are wondering, what are these questions? What can these questions be? Now you are pregnant. What are those questions you are expecting from your healthcare provider, your midwife, your doctor? These are the questions you will be asked in your first antenatal visit. The first one is your menstrual history, which includes your LMP, your menstrual cycle length, for those of you that track their menstrual cycle. The LMP there is the last menstrual period. That is the date of the last menstruation before you discover that you are pregnant. And this date is not the day the menstruation ended, but rather the date it started. Last there does not mean the day it ended. It simply means the last menstruation you saw before you discover that you are pregnant. So whenever you are asked this question, give them the date the last menstruation started, not the date it ended. Except you are specifically asked to provide the date it started and the date it ended. Another question is your obstetrical history. This obstetrical history is a record of your past pregnancies. How many pregnancies you've had in the past? How many did you carry to term and delivered? How many children do you have? How many abortions have you had? Have you had any miscarriages? Anything related to your past pregnancies, that is your obstetrical history. Another question is your medical history. This medical history includes some illness that you as an individual might be suffering. If you're hypertensive, you tell them. If you're diabetic, you tell them. Any illness at all. Another question, your family history illness. Any illness that you people suffer in your family, not you as an individual, no, as a family. It might be sickle cell, it might be epilepsy. Anyone that runs in your family, just give them the information. They will also ask you the medication you are currently taking, whether prescribed or not prescribed. Tell them if you are taking any medication, including your local herbs, the abo that we all know. And this is where it gets interesting. They will also ask you your age. Please, don't hide your age for anything. It don't have anything to do with the age. Rather, the information is required so that appropriate care will be given to you and your baby. So before you go, gather all this information, recall your past health issues, and go with an open mind. The more honest you are, the better your care. So now you are pregnant and prepared. Let them bring the question, because you are just coming out from Nurse Priska's page and you have nothing to worry about. I hope I am able to permanently treat that mind-skipping syndrome.